call the Senate Public Health and Welfare Committee to order. I appreciate everybody showing up today on this beautiful weather we're having. I trust everybody got here safely. I do know we have probably at least one conferee that's having difficulties, so hopefully it's not too bad. Today, just to make a quick announcement so everybody understands, we're going to operate differently than normal. Normally, only senators in attendance on the committee can ask questions and vote. Today, that's been waived, so we will be taking votes from those members that are attending via WebEx. So if that seems different from what we normally do, it is, but it is just for this one day. Again, I do appreciate everybody showing up today, and without further ado, our reviser is with us online, Jenna Moyer, to give us a bill overview of Senate Bill 501, and the hearing is for Senate Bill 501 is now open. Jenna?
Good morning. I hope everybody can hear me from my home office, and we appreciate the ability to come in remotely because when schools are closed, daycare is also closed. So you might get to see Eleanor here, depending on how quiet she is. But this is Senate Bill 501. And this bill relates to public assistance and enacts additional requirements for the Department of Health and Environment and DCF related to eligibility and fraud investigations. There's a new section in this bill, and this section requires the Secretary of KDHE to submit to the U.S. Centers for Medicaid and Medicare Services to submit a waiver to eliminate mandatory hospital presumptive eligibility. And if this 1115 waiver is denied, it would require the department to submit a request for reapproval every 24 months. And additionally, subsection D would require, it adds additional requirements for hospitals regarding presumptive eligibility, and it would require the department, would require each hospital to notify KDHE each time a hospital makes a presumptive eligibility within 5 days from the date that such determination was made. Requires hospitals to assist individuals who they determine to be presumptively eligible to complete and submit those applications for medical assistance, and to notify such applicant that if the applicant does not submit that paperwork, that presumptive eligibility would end, and notify the hospital, notify the applicant on all relevant forms the date that the coverage would end if that application is not received. And the KDHE would use standards to establish whether or not a hospital was accurately determining presumptive eligibility, including whether or not the department receives within 5 days that notification, and whether the hospital application was received by the department before the expiration of that eligibility period. Subsection F adds that the first time a hospital fails to meet these new standards, that the hospital would be given a written notification that the standards were not met, an explanation why they were not met, and then an explanation that if another failure occurs, what would happen. This would be subsection F2. If a hospital fails to meet that standard again within 1 year, the department would notify the hospital within 5 days, and that notification would include a description why it was not met, confirmation that all hospital staff would be required to participate in mandatory training on presumptive eligibility rules, a description of the appellate procedures a hospital could use to dispute the finding, and that if the hospital fails for a second time within a year to meet the standard, the hospital would no longer be allowed to make presumptive eligibility. Paragraph 3 states that if a hospital fails, which would be a third failure, a failure within 1 year of the second failure is how it's worded, that the department would notify the hospital. Again, a description that the standard was not met, why it was not met, a description of those appellate procedures, and a confirmation that effective immediately, the hospital would no longer be required or no longer be qualified to make presumptive eligibility determinations of any kind. This bill also amends KSA 39709, which we just generally referred to as the Public Assistance Statute. And it's a very long statute, but the first change that's not technical cleanup is on page 11. And it requires that the Secretary for Children and Families shall not exercise the state option to provide any exemption from the work requirements under federal law. And it would require DCF to assign all individuals subject to those work requirements to be assigned to an employment and training program. The next change is on page 12, and it requires a household receiving food assistance to be subject to federal reporting requirements. At the end, or it's a subsection C on page 12, paragraph 3 requires DCF to not accept self-attestations of income, residency, age, household composition, caretaker, relative status, or receipt of coverage without verification prior to enrollment. And it also would require DCF to coordinate with appropriate law enforcement entities, including the FBI, the Attorney General, and local law enforcement entities to conduct on-site inspection of authorized retailers that accept EBT, which we may know as food stamps, transactions to identify any suspicious activities at those locations. And then you can flip forward several more pages in the bill. The major changes come, or the last sort of major changes come on page 24, which would be a new subsection M. And it would prevent the Department of Health and Environment from accepting eligibility determinations for medical assistance, which you know as Medicaid, from an exchange under federal law. And the department may accept assessments from an exchange, but would be required to verify eligibility determinations. Paragraph 2 would prevent KDHE, would require KDHE to submit a waiver to prohibit re-enrollment and deny eligibility for at least 6 months for non-disabled, non-pregnant individuals who are between 19 and 64 years of age who fail to report a change in circumstances that would affect their eligibility for Medicaid. And if that approval for that 1115 waiver were denied, KDHE would be required to resubmit that application within 24 months. Excuse me. And this would also require the Secretary for Children and Families and Secretary for Health and Environment to enter into data matching agreements, which you may know colloquially as cross-checks, to obtain household information for those enrolled in either food assistance or medical assistance, and would require those DCF and KDHE to review this list of information that would indicate a change in household circumstances that may affect eligibility for either food assistance or medical assistance. And this would include, and there's several of these, this is on page 25, would be information from vital statistics on a monthly basis, including death records, information from Department of Labor every quarter at least, including changes in wages or employment, and information from DCF at least every month, including out-of-state EBT transactions to identify any changes in residency, information from Department of Revenue at least every quarter relating to tax records to identify any changes in income, wages, or residency, information from the Department of Corrections every month at least, and information from the Department of Labor at least every other month related to changes in employment. And it would also require every quarter at least DCF and KDHE to make findings related to noncompliance and fraud investigations, including the number and make publicly available information from those investigations related to fraud and improper payments and expenditures. And I know that's sort of a long bill brief, much longer than my usual, but it's kind of a complex bill, so I'll be happy to answer any questions.
Jenna, thank you for the overview. Committee, do we have questions for the reviser? No. Not seeing any. Jenna, thank you very much. Committee, we will next move to proponent testimony. And for those that are testifying, either virtually or orally in person, if you could keep your time to 4 minutes or less, that would be greatly appreciative. We have several conferees, and that way we can get through everybody. We do have one proponent testifying virtually, and then we have one written only. The proponent testifying virtually is Sam Adolphson, Visiting Fellow of Opportunity Solutions Project. Sam, welcome to the committee.
Thank you very much. I appreciate the opportunity to testify. My name is Sammy Adolphson, Visiting Fellow at the Opportunity Solutions Project. I'm glad to speak in support today of Senate Bill 501. And as a Mainer, I appreciate the fact that I can testify virtually during a snowstorm, as we have many of those out here as well. This is a comprehensive bill, obviously. We just heard a lot of detail about it. And so I don't want to go piece by piece and kind of, re-explain the different pieces. So I'll just give a quick overview. It is a comprehensive bill, and really taken together, the goals of this bill are just common sense. So the bill will protect welfare benefits for the truly needy, and it will help move able-bodied Kansans from welfare to work. So that's just, all the detail in here is important, but those are really the overarching goals of the bill and why we support it. So I just want to hit on a couple of the specific details. And really, despite kind of a bunch of different pieces, there's a couple very key ones that I want to mention that I think are the most impactful and the most important pieces of the bill. So those are two key provisions that are directly focused on getting able-bodied adults on food stamps off the sidelines and back into jobs. And so obviously, I think we can all agree that making welfare programs work better for the truly needy is important. And this bill and these two provisions I want to mention are especially critical right now because Kansas has a workforce shortage crisis. There are 95,000 open jobs in Kansas, and there are tens of thousands of able-bodied adults on your welfare programs that could fill those open jobs. So here are the two key provisions. The first one's on page 11, section 17D, and this is really basic. The state has been given an allotment of exemptions to exempt people from a work requirement. These are able-bodied adults that don't have kids in the house. And the bill simply says, in Kansas, we're not going to use those exemptions. We're going to ask people to be in training or go to work. And if they're able to do that without kids in the house, and keep those exemptions on the shelf. And that's important because you have so many of those exemptions piled up, you could keep people out of work, the entire population, for a long time. Now, the Kansas Legislature actually did this back in 2015. However, Governor Kelly and the agency tried to use these exemptions anyway, and were only stopped when the Attorney General stepped in and said they couldn't be used. So this bill just makes it very clear that those exemptions to work won't be used. And then on a similar note, the second provision I wanted to highlight is having each of your able-bodied adults on the food stamp program participate in an employment and training program. And I mentioned all the available jobs in Kansas. This is really the state reaching out to help people who are out of work, saying, hey, come take advantage of our training programs, our education, our job search help, and participate in that program. And right now, there's only about a few hundred people in the whole state out of more than 40,000 participating in that program because it's voluntary and they're not showing up. So this bill would make that mandatory and make sure that those folks are taking advantage of the resources that Kansas has. And then finally, just in the interest of staying under the time limit here, all the other provisions mentioned around Medicaid, hospital presumptive eligibility, not accepting applications from the federal government through the exchange, those all get at one key problem, which is that in Kansas, 28% of all Medicaid spending is improper. 28% is improper payments, and that comes straight from the Medicaid agency. And 99% of those errors are eligibility related. So Kansas really needs to look at a few of the loopholes that have created that opening for such a high error rate, and those are addressed in this bill through data cross checks and ending hospital presumptive eligibility and a couple other pieces as well. So with that, I'll close, and I'm certainly happy to take any questions from the committee, and I appreciate the time.
Sam, thank you for your testimony. Committee, do we have any questions for the proponent?
Mr. Chairman, this is Senator Petty.
Senator Petty, go ahead.
Thank
You have the floor.
Okay, Sam, as I think I heard you say you're in Maine.
Yes, ma'am.
Okay, and is that where you reside?
Yes, ma'am.
You've been to Kansas?
I have.
Okay, when?
I believe I was.
Senator Petty, come on. Let's not give a litmus test of every
well,
inquiry that comes up about their location of where they live. Let's stick with the bill context, please.
I am. But when it comes to legislation like this, I think it's important to think about Kansas because we're talking about legislation that's going to very adversely impact Kansans. So, Sam, you mentioned that the goal is to protect welfare benefits, move to work. So, of those that are presently on welfare in Kansas, so are you maintaining through this legislation that everybody that's on welfare has the ability to work?
So this bill specifically, the work provisions deal with able-bodied adults on the food stamp program. And they're depending on if you look at the state's employment and training plan or some other data, there's somewhere between 40 and 50,000 of those individuals in Kansas. They're largely do not have dependents in the household, or they have older school-age kids. So those work provisions deal with that population in particular who have a state and federal designation of able-bodied adults. So yes, in that case, I would say those are people that can work, and they might have some issues with, job history or experience or training, and that's why we'd like to see them in the employment and training program so the state can help move them back into a job.
Thank you. And so you mentioned 40 to 50,000, and you also talked about in your testimony about moving to work and talking about the numbers of jobs. But we know that job availability is true throughout the country, but our job availability and having employees is true throughout the country. But when we talk about the state of Kansas, that doesn't necessarily mean that, as you refer to, 40,000 able-bodied, and I would question that term, but able-bodied workers are not always where the jobs are.
Sure. So you have, as I mentioned, about close to 100,000 open jobs. We haven't found that they're really geographically concentrated all to one place. However, the advantage of this particular requirement and the E&T program is that there are options beyond just a paid job in order to meet the requirement. So you can be in adult education, for example, or participating with your career center, doing a structured job search where the department's going to help you apply for jobs. And so there's a bunch of different avenues that someone can go down to get the kind of training or experience they need to get into a job. And so for those that might be in maybe a area where there isn't a job nearby, they have these other options to participate and get themselves ready for that next job.
Do you, with and this, I think that's my last question, but with these with these enforcement tools that are being put in this bill, and I'm certain that this is a piece of legislation that Opportunity Solutions has been moving across the country. Is there any consideration for the cost that is involved and the manpower that's involved with the enforcement tools that are being put in place?
Sure. So we have seen a number of states across the country have adopted some of these different provisions. And there are costs occasionally to some of the administrative pieces. I took a look at the fiscal note, which came out last night. And I think there are some issues with that particular fiscal note and the level of staffing. We've seen states implement employment and training mandatory programs at a fraction of the cost that's kind of outlined here. Texas, for example, spends a quarter of what Kansas does per person administratively. And so I think when you look around the country, as states are finding ways to get these folks back into all their open jobs, there are definitely states that have done this, are doing this very efficiently with low administrative costs. Some of the Medicaid data checks that are in this, what they do is they take advantage of other state data, things like your vital records, which your public health department keeps, things like incarceration records, which are all state-held data. So there shouldn't be any real significant cost with that. So we understand. I used to work in a welfare agency. I understand the reality of staff and administrative costs, but there are ways to do this all effectively to make sure that benefits are going to the truly needy.
To follow up with that, anytime you increase the number of cross checks, you do increase the cost because it takes someone some time to be able to do that. So if you're referring to 40 to 50,000 people and you're talking about cross checks, that does increase. I don't want a response. Thank you, Mr. Chairman.
Senator Steffen.
Thank you. My question really was about this similar laws being enacted in other states and how that was working. I would like to hear a little bit more about how Texas is doing this at a fraction of the cost to Kansas. And I would point out that for each person that you do get off of welfare like that, you have an immediate savings from that standpoint as well. So I do think that fiscal note is incredibly inflated, but comments regarding more about other states and Texas doing it a fraction of cost would be appreciated. Thank you.
Certainly. Thank you, Senator, for the question. With employment and training in particular, there are 9 states that do what's described in here, which is moving from that purely voluntary nature to a mandatory nature where those able-bodied adults without very young kids, they have to participate. So Texas has done this for quite some time with good results. They have 500,000 people in this program, right? So it's significantly larger. They've done a very nice job of streamlining it so that people have a couple clear options when they come into the program. Okay, we're gonna provide you these benefits as a temporary hand up and work with you to get you back into a job. So they're aggressive with a couple things, aggressive with job search, which is not a costly endeavor. In fact, Kansas has laid the groundwork for this by requiring all these folks to register on your job bank, which is good. And Kansas does a good job with that. When they come in, they'll have to register. But what happens is in Texas and some of these other states, instead of just leaving them then and mailing the EBT card and hoping they find a job, they take the next step and say, let us help you apply for some specific jobs that fit your skill set. And then if you need some upskilling, and let us transfer you over to the Career Center. And these, you have these resources available to you already in Kansas for these folks. And then the third thing that Texas does is they will actually assign people to a work environment. They will, once they visit with them and understand where they want to go with their career to transition back off welfare, they will say, okay, We found a spot for you to go get this work experience, and we need you to go ahead and show up at that location and take that particular role. And they've been able to do that, like I said, very cost effectively, and a benefit to those folks as well as they move back into the workforce.
Okay. Senator Thompson.
Thank you, Mr. Chair. Just one follow-up with you, Sam. Do you have any numbers on the actual savings of this program in some other states like Texas? You know, how much they are saving versus having people on welfare?
Sure. Thank you, Senator. So the significant savings, and it was interesting that this wasn't accounted for in the fiscal note, because we typically would see, sure, there's some administrative costs that may need to be looked at, accounted for, but there's typically a savings number, especially when you're talking about Medicaid, right, which has a significant state layout. I saw a similar fiscal note on Medicaid-related provisions in Iowa that had massive savings in the second year. So what I can speak to is that most of those savings come through the data cross-checks on the Medicaid side, and cutting down that improper payment rate that you have of nearly 30%. A lot of that, we believe, is coming through the federal exchange. They are, the federal government is sending applications and deeming people eligible that shouldn't be on the Medicaid side. Again, significant cost to you. And in Kansas, you're just accepting that determination without double checking it at the state level. I would expect very significant savings from those Medicaid components. On the food stamp side, the actual food stamp benefit is federally funded. However, a lot of those same folks are on other welfare programs like Medicaid, which has a state component. And so what we've seen in other states is that as those people go back to work and they move forward with their income, they get their own private health insurance, and they start coming off your other state programs, you're going to see significant state savings there as well.
Thank you, Sam. Thank you, Mr. Chair.
Okay, committee, I do not see any further questions or hear any from anyone online, so this will conclude our proponent. Oops.
Mr. Chair,
Yes.
this is Senator Gossage. I had raised my hand, but perhaps somebody didn't see that. I had my hand raised on there.
Yeah, Senator, I apologize. So, committee members, if you are online, you're going to have to do it audibly. The Capitol is short-staffed, and our tech person is coming in and out. So if you just raise your hand, we won't be able to see it, possibly. So just be audible if you have a question, please. So, Senator Gossage, go ahead.
Thank you, and I apologize. I didn't realize that. I had difficulty getting in initially, and you may have already said that. So my question for Sam is, one, thank you for being here. And two, the committee may recall when we had a hearing on Secretary Stanek that I brought up the fact that our goal should be to get as many people off of government welfare and onto their own job and help them to be self-sustaining. And unfortunately, fortunately, there was time for a short while where they really weren't checking the roles. People were put on to some of the programs. They did not qualify for the programs, or later were found not to qualify, but they've stayed on the rolls. So of course that is one issue, and I don't think anyone thinks that's a good idea. We want to keep those funds and keep those programs for people who truly do qualify. The second thing that I would mention is we talked about government using government programs to help people get back to work. And in the meantime, spoke with Sarah Furtick about this very issue. She was in total agreement. She had emailed me about 3 different programs that have not been used as effectively as they would like and haven't reached out to as many people as they would like to do, that we already have here in Kansas, that we could do those types of things, but they're actually not being done and not codified in law. And something that has not been mentioned, if I may, Mr. Chair, is that when we get people off of welfare, or when people go off of these programs, whether it's food stamps or on Medicaid that they don't qualify for, whatever this may be, as long as they're on those programs, they have a disincentive to be able to go back to work. And if they're not checking to see if people are even applying or actually coming in and trying to get a job, we have heard from employers that have said, well, yeah, we have people come in and fill out applications, but when you call them, they're like, well, I just did that so that, you know, I can continue to receive my unemployment benefit. All of this we really need to take a hard look at this. And finally, when you have somebody that is not working or receiving these programs and they don't qualify for them, one of the best things we could do is help them get back to work, take them off these programs, and give them that pride. There's a certain pride that we have here in Kansas of being able to take care of yourself, being able to be self-sustaining, especially if you're capable. And as one person said to me, this feels foolish that I would walk away from government programs that they're letting me have until I'm forced to do that. And sometimes what we need to do is pull that away, help them get into those programs, let that coincide together. And I really support this bill. Thank you very much, Mr. Chair.
And
Mr. Chair, this is Senator Baumgardner. I also have my hand up.
okay, is it Senator Baumgardner? Go ahead.
And Sam, I apologize. I too had a little bit of difficulty getting in, I'm hoping that the other proponents and opponents will share this, but why is the participation rate, in your opinion, for that mandatory SNAP employment and training so low in the fiscal note of the bill?
Thank you, Senator. So is the question, why is the current participation so low in the program?
Yep.
It's because it's voluntary. And we've seen this time and time again across the country. I saw this personally. We set up a voluntary program when I was working on an ENT program in the state. And there just isn't the interest from that population in pursuing it on their own voluntarily. There's some margin, 400 people in Kansas. You need to structure it that it's a requirement of the program. And we've seen that time and time again. Without that, you're not going to get that particular rate. Now, even with mandatory, many people are going to pursue work outside of the ENT structure. And so we've seen that as well, where there's many people who say, well, I really don't need the training or the help with the application. I'm just going to go get a job. And so that's happening some now, but it's going to happen a lot more when you put that mandatory structure in place. And we've seen that state to state.
Thank you very much.
Senator Holscher, did you have a question?
Oh, only, I'm just looking for the fiscal note. And I'm guessing there's one. I'm not seeing it online.
Yeah, there is one online, and Donola just emailed it to you as well. So.
Okay, great. Thank you.
You're welcome. Committee, that does wrap up our proponents. We are going to move to opponent testimony. And, well, actually neutral. We do have one neutral, Sarah Fertig with the Medicaid Inspector General. And Sarah, if you could keep your testimony, if you can, under 4 minutes, that would be greatly appreciated. Sarah?
Certainly. Thank you, Mr. Chairman, and good morning, committee. My name is Sarah Fertig. I am the State Medicaid Director with the Kansas Department of Health and Environment. KDHE is neutral on this bill. However, we did want to raise a couple of concerns that we had about it for the committee's consideration. We also submitted written testimony, and my oral testimony will kind of follow the structure of our written testimony if you wish to follow along. So at the top, the bill would require certain new requirements for presumptive eligibility. Specifically, it would require us to submit a request for an 1115 demonstration waiver to eliminate mandatory hospital presumptive eligibility. Just to clarify for the committee, hospital presumptive eligibility is not mandatory. We wouldn't need to submit an 1115 waiver to do that. It's something that's allowed under federal law, and the state has opted to offer that. So under presumptive eligibility, it basically provides an express lane for Medicaid eligibility determinations. We currently have about 43 entities who are approved to conduct those eligibility determinations. Only about half of them are hospitals, though. This bill, by its language, only applies to hospital eligibility, so it wouldn't apply to the other 22 presumptive eligibility entities who conduct those determinations for us. So the way presumptive eligibility works, like I said, it provides an express lane for Medicaid eligibility for those who are uninsured. And the entities who are approved to conduct presumptive eligibility determinations have to go through mandatory training through the agency, and they use a CMS-approved online portal to conduct those determinations. And this would come into play, say there's a car accident and one of the injured individuals is taken to the hospital, they're not insured, the hospital would be able to assess whether or not that person is potentially eligible for Medicaid and conduct a presumptive eligibility application to see if they would be eligible. And then that allows both the hospital and the patient to have some reassurance that some of those bills would be covered. So that's kind of the whole purpose of PE. But a couple things we wanted to point out with this bill, it would codify certain requirements on presumptive eligibility. Most of those we're already doing as an agency. And in some cases, our requirements are more strict than what this bill would require. For instance, under section 1, subsection D1, it would give presumptive eligibility entities 5 business days to let our CanCare clearinghouse know of a presumptive eligibility determination. Right now, we only give them 2 working days or 2 calendar days. So it would actually give more time for that information to be transmitted to the clearinghouse. It would also give appellate rights to hospitals if we terminate a presumptive eligibility agreement with them. Right now, they don't have appeal rights. We just terminate the contract. And it would only affect some of our presumptive eligibility entities. Like I said, about half of them currently are hospitals, the rest are clinics. So we're not sure if the intent of the bill is to only apply to hospital presumptive eligibility, but for the committee's information, there are 22 other entities who are authorized to do that. We also note that this would only affect certain Medicaid eligibility groups, specifically only low-income parents and caretakers, aged out foster care children, and women who have been screened for breast and cervical cancer through the Early Detection Works programs. Those are the eligibility groups who would no longer be allowed to use the express route of presumptive eligibility. Talking a little bit on the penalty periods. This is, if you're following along in the bill, this would start on page 24, around line 33. It would require the state to submit a request for a waiver to impose 6-month penalty periods for any non-disabled, non-pregnant adult aged 19 through 64 who fails to report a change in circumstances that affects their eligibility for Medicaid. Again, this would only apply to low-income parents and caretakers. These are folks whose eligibility threshold is 38% of the federal poverty level. So in Kansas, if you're a single mom with 2 kids, you have to earn less than $729 a month to qualify for Medicaid. So this is a pretty small, very, very poor population. We do have some concerns about whether the Biden administration would allow that type of waiver to go through, but the bill would require us to keep trying until we received a favorable determination for that. So our concern here is that this could create some churn for our eligibility team, and it might require us to hire more staff in order to process those applications. And the third thing we wanted to highlight, Mr. Chairman, is on the requirements for data sharing and verification. And I wanted to correct something that Mr. Edison said. He said that Kansas currently accepts eligibility determinations from the insurance exchange. To be clear, we do not. We consider those referrals to the Medicaid program, we conduct our own independent verification of all of those referrals that we receive through the exchange. So just to clarify, that is what we currently do. And the bill would also require us to establish some data interchange with various agencies. We already do that with most of the agencies. For instance, we have a data feed with the Office of Vital Statistics and with the Department of Corrections. However, the additional IT work that would be required to meet the terms of this bill is estimated to cost about $2 million all funds. This would be eligible for a 75% federal match. So the SGF lift would be closer to about $500,000. And Mr. Chairman, I realize I'm running low on time, so I will pause there and I will hold for questions at the appropriate time. Thank you.
Sarah, thank you for your testimony. Senator Holscher, do you have a question?
Yes,
for
I
Sarah?
do.
Okay, go ahead.
Yeah. I just want to go back here for a second. You mentioned there are only 43 entities that conduct the presumptive eligibility. 22 of those are hospitals. So I just want to make sure I'm understanding this clearly. So you would potentially have somebody who's been in an accident, who's at the hospital, and then they're on what you call this express lane to be able to get their benefits. Am I understanding that part correct?
Mr. Chairman, that's a correct summary.
Okay, and then if I may follow up with that. So I'm guessing if they, if we're talking about a person who's been in an accident, there might be the possibility they might not be able to work for a while if, depending upon the severity. But it sounds like you said what's being looked at or assessed are low income, aged out foster and caretakers. Like I said, I was just trying to kind of connect the dots there as far as if these are people that potentially couldn't work for a while just because of the fact they're in the hospital.
Sure. Mr. Chairman, so when we conduct eligibility determinations, we look at the person's income as of the date we're assessing them for Medicaid eligibility. So we don't consider whether or not the person can work in the future, if they sustained an injury that would keep them out of the work. That's not really something that we consider when we're determining whether someone is eligible for Medicaid today. But yes, the populations that would be impacted by this bill on the presumptive eligibility determinations are low-income parents, aged out foster care youth, and women who've been diagnosed with breast and cervical cancer. Those are the only populations that would no longer be able to use the express lane through presumptive eligibility.
Okay, thank you. Yeah, no, those are obviously concerning populations that would no longer be eligible. Okay, thank you so much.
Sarah, I do not see or hear any more questions for you, so thank you very much.
Mr. Chair.
Oh, so we do have
Sorry,
one.
it's Beverly again. I was saying it and then I realized I had muted my microphone. So let me come back. Sarah, thank you so much for being here and I appreciated your email. Two quick questions for you. One, what happens if the hospital does a presumptive and then it's found to be that they're not eligible for Medicaid?
Thank you, Senator. And Mr. Chairman, so presumptive eligibility only gives somebody temporary eligibility for Medicaid. So the way it works is if, based on the information, the hospital or the presumptive eligibility entity receives, if they determine that that person is presumptively eligible, that period of eligibility is only good through the end of the following month or until such time as the CanCare Clearinghouse makes a decision on the application. So if the individual never submits a full Medicaid application, their presumptive eligibility period would end at the end of the following month. So I'll use today as an example. If someone was determined presumptively eligible today on March 10th, if they did not submit a full Medicaid application, their eligibility would end April 30th. So if that later turns out to be erroneous, Senator, really the impact is that the state would have paid for, 2 months of eligibility for that individual when perhaps they shouldn't have. I would add, though, for the committee's benefit, we require all of our presumptive eligibility entities to have a very, very high rate of accuracy. Between 95 and 98%, I believe, is what's in our contract. So we demand a lot of accuracy. And so far, we haven't had a lot of issues with that. We're finding that our presumptive eligibility entities are meeting that high level of accuracy.
That's good to know. So, however, let's say that you did have someone, they go into the hospital, they accumulate claims. The claims are starting to come in to Medicaid, and they usually come in within that first 30 to 60 days. And then it's discovered the person does not qualify for Medicaid. Is the payment not made? Does the payment then go to the individual because they didn't qualify for Medicaid?
That's an excellent question. Mr. Chairman, the way it works, if you're presumptively eligible for Medicaid, about 95% of the Kansas population is under managed care. So the state would be making capitation payments to that person's MCO. Those are full risk payments. So the cost of that individual's care would then fall to the managed care organizations to cover. So the risk to the state is basically the cost of a month or two of eligibility payments during the presumptive eligibility period. So while they're eligible for Medicaid, we will pay those bills. And when their eligibility ends, if it happens to be at the end of the following month, if they don't complete a full application, after that, the state or the MCOs are not on the hook for any additional payments for that person.
But in the meantime, they are. So even though they were not qualified, they were presumptively qualified. So the state would be on the hook for paying those claims to the MCO, correct?
We would be responsible for paying the capitation payment, basically the monthly premium for that person for the MCO. The state would not be on the hook for the hospital claims for a person who belongs to one of our managed care organizations. We would be on the hook for the monthly capitation rate. If it's $400, that would be $800 that the state would have been on the hook for. The managed care organization would be responsible for the hospital bills incurred during that time of eligibility.
Great. And finally, Mr. Chair, Sarah, could you just outline the programs that you mentioned to me, the work programs here in Kansas?
Certainly, Mr. Chairman. So we shared some information with Senator Gossage on 3 work programs that Medicaid administers, and these are designed for individuals with disabilities who choose to engage in the workforce. And so we have one of them called STEPS. This is one, those of you who are on the CanCare Oversight Committee, you've heard us talk about that. This is a relatively new program for individuals with qualifying disabilities or behavioral health, serious behavioral health conditions to allow them to achieve competitive integrated employment. We also have the Working Healthy and Work programs, which are, again, programs to encourage individuals who are on Medicaid who have disabilities to find competitive integrated employment, and it allows them to keep more of their money while still receiving health benefits from Medicaid.
My apologies. I had not looked at the links that you sent me. I have them earmarked to do this weekend. So those were only for the disabled. Thank you very much. And thank you, Mr. Chair.
Senator Erickson.
Thank you, Mr. Chair. Thank you, Sarah. Just a couple of quick questions based on the testimony from a previous proponent. The statement was made that there's a 28% improper payment rate for Medicaid, and that 99% of that is eligibility related. If the problem isn't with the presumptive eligibility determination, where is that issue?
Thank you, Senator. And Mr. Chairman, we're familiar with the report that the proponent referenced. I would add that that report was based on information from around 2019. Those of you who have been in the legislature for a while may recall that there were a number of problems with the CanCare Clearinghouse around 2017, 2018, 2019, including accuracy issues with the state's former contractor, Maximus. And as a result, the state has taken a number of actions to drastically decrease the rate of improper payments and improper eligibility determinations. For instance, we have since in-housed the elderly and disabled application process. And so we expect to see those error rates go down dramatically. In fact, CMS recently asked the Kansas team to present on our success in reducing those error rates at a January 2022 conference. So we've done so well in turning that around that CMS is holding us out as a model for that.
Sarah, thank you for your testimony. Committee, this does wrap up our neutral testimony. Opponents, there are not, for those of you that are testifying, I know we look at the clock and we have like 8 minutes left of our time. I did verify there is no meeting afterwards, but I do have a meeting. But I think your time is just as important as what we have. So if I leave, it's not because I don't want to hear your testimony. I am going up to another meeting, and Senator Erickson is going to step over and allow you guys to give your testimony. So with that, we're still going to please ask you to keep it for under 4 minutes. Our first opponent is John Wilson, President of KAC. John, welcome to the committee.
Thank you. I'm really glad to be here. Long-time listener, first-time caller. Happy to be in front of the committee. Mr. Chairman, my name is John Wilson, President and CEO of Kansas Action for Children. We are a nonprofit advocacy organization working to make Kansas a state where every child has the opportunity to grow up healthy and thrive. I'm gonna skip around in my testimony so I can cover the high points. We have several concerns with this bill. First, this bill creates new reporting and verification processes that would require rapid and extensive bureaucratic expansion for state agencies. Second, it requires multiple state agencies to create new technology systems, practices, and staff positions that will increase costs to the state. And finally, it enacts new mandates for the Kansans who are facing temporary financial hardship and are trying to get back on their feet and back on the path to self-sufficiency. And we think all of these changes proposed in the bill are going to add to state government cost at taxpayers' expenses without much to show for it. Want to highlight that Kansas Action for Children, part of our work is to go around the state and visit with folks in community who are directly impacted by the programs and policies determined up here in Topeka. Got to say that in none of those conversations have we heard any desire to add the types of changes proposed to these programs, and at the same time also haven't heard from folks who want to stay on programs like Medicaid or SNAP. In fact, I think some of the hardest working people that I have met in our state are people who are experiencing these recurrent financial hardships, who are just simply looking for some support as they try to get back on their feet. Would also add that in 2019, Kansas conducted a comprehensive statewide needs assessment that covered all 105 Kansas counties, 100 in-person community events, and talked to over 6,100 Kansans. And one of their top findings was that Kansans are struggling to meet their basic needs, particularly parents. And so barriers proposed in this program would further exacerbate that problem. And I should note that this needs assessment was done even prior to the pandemic. A couple other things. You can see the rest of my remarks in written testimony, but I want to point out a couple of things. Just a reminder that for Medicaid eligibility, I know you all know this as a committee, but we're talking about a max income of $8,751 a year for a family of 3. Not a whole lot. And in SNAP, it's $28,548 a year for a family of 3 to get on an average of $1.40 per meal per person in benefits. A couple more points just to address some of the concerns brought up by proponents is we don't currently use those exemptions that were referenced, but I would say that we have the opportunity to use those on certain populations if we wanted to. Let's say we wanted to use it to support kids aging out of the foster care system, or for disabled veterans, or if we wanted to use it in times of natural disaster. Those could be times to use something that is a benefit made available to us by the federal government. And then the last thing I will say, Mr. Chair, is that all of these programs and the talk of folks getting back to work, there are other challenges at play that are really complex that I think the legislature needs to address. Even if somebody wants to work right now, which most people who are on these programs are working if they're able to, childcare is incredibly expensive in Kansas, with average infant care being around $935 a month. So there are other barriers to Kansans getting back to full employment and being able to contribute to their communities in the ways that we all want to see happen. I'm here with my colleagues who spend way more time in this committee than I do. We can answer questions as they come up, but I appreciate you taking time for this.
John, thank you for your testimony. In committee, we will hold for questions until every opponent has had an opportunity to speak. Committee, our next opponent is Karen Siebert, Public Policy and Advocacy Advisory for Harvesters. Karen, welcome to the committee.
Thank you. All right. I'm Karen Siebert, and I'm here today on behalf of Harvesters, the Kansas Food Bank, and Second Harvest Community Food Bank. Our networks of charitable food pantries serve the food insecure in all 105 counties in the state. We oppose Senate Bill 501 and delineate our concerns in our written testimony. But I want to take this opportunity to lift up the voices of Kansas's nonprofit food pantries because they're on the front lines fighting hunger and food insecurity in their communities every single day. This bill will reduce the number of people receiving federal SNAP benefits, but does nothing to improve their food security. These families still need to put food on the table tonight. They need to feed their kids tomorrow. So they'll turn to their local food pantries for help. The folks that run these pantries, most of whom are volunteers, many of whom are senior citizens, serve their communities and their neighbors tirelessly. They're passionate and committed and hardworking and creative, but even they can't take 5 loaves and 2 fishes and feed 5,000. We do not have the resources to help all of the food insecure people in the state who will come to our doors if this harmful bill is passed. And I would like to take this opportunity to clarify a few things that were stated previously about what's commonly referred to as ABODs. Able-bodied adults without dependents, by federal law, have to be working at least 20 hours a week or be in a federally approved job training program, or they do not receive SNAP food assistance. So that is why, if you look at the fiscal note, it indicates that like 9% of people of ABODs would be participating in the program, and that's because the other over 90% are working. They're already, ABODs are by definition the working poor, or they would not be allowed to be in SNAP by federal statute. The one exception to that is there are 3 months during which time someone might not be meeting that minimum hourly requirement. I sort of think about them as months of grace. And those 3 months have a 3-year period to be used. So for example, you have basically 1 month out of a year where you might not meet that minimum threshold of hours at your job. Say you're a young woman who's waiting tables and your mom gets sick and she passes away, and you've got to deal with all of the arrangements. You've got to clean out her apartment. You've got to figure out what you're going to do with your younger siblings. And you can't meet that work requirement that month. You can use one of those 3 months to get by. We'll still say, yes, we'll help you with your food assistance until you can get back to your job. It's those kinds of things that those 3 months are used for. Again, you only get 3 months out of a year, and the federal program will kick you off. So that's why that participation rate is so low. When it says in the fiscal note, I think it uses the term uninvolved ABODs. They're uninvolved with the SNAP Employment and Training Program because they're working already, and so they have a job. And I think also it was misstated in Mr. Adolphson's testimony that we have like 40 to 50,000 ABODs or something like that. The number is actually 14,000 in Kansas, I think, per the fiscal note. So I just wanted to clarify that. And on the point of the federal savings, I think it's important to note too that these costs that are talked about in the bill are all borne by Kansas taxpayers. But if people are removed from the SNAP rolls, all of that benefit goes to the federal government, because those are federal SNAP benefits are funded 100% by the federal government. So Kansas will receive none of those savings directly. And in fact, we'll have the added problem that those people will turn to the charitable sector for help. And those folks at those local food pantries are going to have to find those food resources to help them because we've turned away those federal benefits. So I just wanted to clarify that. So thank you. And I'm happy to stand for questions at the appropriate time.
Karen, thank you for your testimony. Committee, our next opponent is Rabbi Modi Reiber, Kansas Interfaith Action. Rabbi, are you with us virtually?
I am, Mr. Chairman.
Welcome to the committee.
Thank you. Can you hear me okay?
Yes.
Okay, thank you. I'm Rabbi Moti Reiber. I'm the Executive Director of Kansas Interfaith Action. We're a statewide faith-based advocacy organization that works on a number of important policy issues. We're the representative of a number of the mainline denominations in Kansas, including, and also Jewish and Muslim communities and individuals. And of course, I'm testifying against SB 501. All the denominations that make up Kansas Interfaith Action have statements about so-called welfare reform and the impact of bills like this on families. The primary concern we have is on the dignity and well-being of our poorest citizens. I'll just read one little sentence from the ELCA social statement. God's concern is for all, but God has special concern for people who are poor. And the ELCA commits to addressing the causes of poverty and calls for particular scrutiny of policies that affect the poorest people with the aim of investing to improve their lives. So you have my written testimony. I won't go through it piece by piece. The three main points are that policies like this do not help to raise people out of poverty. Instead, they force them off the rolls through onerous documentation needs and cross-checking, but getting people off the rolls is not the same thing as giving them a hand up. It's disrespectful to the people who are struggling in our lives to treat them as cheats and frauds and to continually make them jump through hoops to maintain their sparse eligibility. Second, as KDHE person said, it will be expensive for state enforcement and will cause staffing issues, and people will have to come in to do this work. It'll cost far more than whatever benefits it saves. And thirdly, it'll cause stress on the charitable sector, where people who are already in food insecurity will be relying on churches and other faith communities and other public charities for food, which are already overstressed from the pandemic and other economic struggles. So I have a couple of more points I want to make. I have already said that forcing people off public assistance through onerous documentation is not an anti-poverty program. I think there's also kind of a sense of, what kind of jobs are you thinking that people are going to go into? The minimum wage jobs that we haven't raised the minimum wage in Kansas in over 10 years. It's not enough to support a family. It's not enough to rent an apartment, and it doesn't support health insurance. The idea that people are going to get a job and they're going to get private health insurance, somebody who's on food stamps or was on SNAP, or is going to get into a job that's going to give them private health insurance is kind of laughable. The way to deal with eligibility issues, which this bill focuses on so strongly, is by expanding Medicaid. Medicaid in Kansas is notoriously restrictive, as has been testified. We have to earn less than $729 a month to be eligible. The policy that will give poor people access to health insurance, to health care, is Medicaid expansion. For the last 2 years, this committee has refused to have a hearing on that issue. That is a policy that would help people. Instead, we get cruelty like this. I urge this committee and I urge this Senate to vote against this bill. Let's have the conversation about the policy that will help people instead of punishing the poor. Thank you.
Thank you, committee. Next, we have Hayley Kotler, Kansas Appleseed Center for Law and Justice. Welcome, Hayley.
Hello, members of the Senate Committee on Public Health and Welfare. My name is Hayley Kotler. I am with Kansas Appleseed Center for Law and Justice. I'm also a resident of Senate District 30, so love to see that you're chairing this committee. Kansas Appleseed is a nonprofit, nonpartisan organization dedicated to the belief that Kansans working together can build a state full of thriving, inclusive, and just communities. My role at Kansas Appleseed is I work on most of our economic security and food access work. So we have a team across the state of 4 who work specifically on SNAP food assistance, child nutrition programs, and just ensuring that more Kansans have access to the food that they need to thrive. Kansas Appleseed opposes Senate Bill 501. We really believe that this bill undermines the Kansas values of fairness. It further tells Kansans with low incomes that the rules are different for them. This puts too many burdens on Kansans, state agencies, and we believe that it is fiscally irresponsible. Most of my colleagues today and others have really covered the points, so I won't go into really depth on a lot of this, but I urge you all to read my testimony. But I just want to talk about who the truly needy are in Kansas. My team has the honor and the privilege to work across the state with poor Kansans. We have something called Hunger Action Teams, where they're regional teams that people are coming together to talk about the issues that Kansans are facing around food and food insecurity. There are so many truly needy people in Kansas. It is 1 in 8 of your constituents. 1 in 8 Kansans are going hungry. In Southeast Kansas, the number for hungry kids is 1 in 4. And so we're not just talking about a few Kansans. We are talking about hundreds of thousands of Kansans who are going hungry. So with that, I just really want to implore you all to oppose this bill. We believe that it is bad for Kansas, and thank you. I'll stand for questions at the appropriate time.
Thank you so much, Hayley. Next, we have Gail Kozid. Apologize if I did not pronounce your name correctly. CEO, Kansas Children's Service League. Welcome to the committee, Gail.
Thank you. Gail Kozad, so you were very close. Yes, I am the CEO for Kansas Children's Service League. We are a nonprofit statewide organization. We serve as the chapter for Prevent Child Abuse America. Everybody here today has really eloquently said why KCSL opposes this bill, but what I want to give you is kind of the reason why it is so near and dear to us. The saying goes, if you give a man a fish, you can feed them for a day. But if you teach a man to fish, you can feed them for a lifetime. I've been thinking about this as I was thinking about the hearing today. And then I started doing some research. Did you know that you can learn the basic skills of fishing in 4 to 5 months? 4 to 5 months it takes to just learn the basic skills. But a professional fisher will tell you that it takes up to 6 years to really master that skill of fishing. We teach our children how to be good employees through 18 years when you have parents who have the ability to show them that capacity and model those skills for them. So what we have to do is for the families, which unintentionally may be impacted by this bill, parents and children, is we need to be able to help them and continue to support them while those parents learn the skills necessary to become gainfully employed. And at KCSL, we have great success with that. And I know there are many community partners that have great success with that. But I just wanted to put in perspective that this is not an easy fix for people to find gainful employment and actually become contributing members to society, not, as some people here have said, get a job that may not even lift them out of poverty. Because if we're not lifting them out of poverty, we're just continuing a cycle of poverty. And that will not in the long term benefit Kansans. So I also will stand for questions. Thank you.
Thank you so much. Committee, next we have Megan Word, Government Relations Director, Kansas and Nebraska. Megan? Megan, are you with us via WebEx? Okay, we will skip over Megan and see if she joins us later. Okay, Sean Gatewood, CanCare Advocates Network. Written only, so we're going to have a change there. So Sean is written only. Okay, Sandra Kemmons, Director of Economic and Employment Services for DCF. Sandra?
Hi, this is Sandra. I'm on WebEx. Can you hear me?
We can hear you. Thank you very much. Okay. You may proceed.
Great. I am Sandra Kemmons. I'm the Director of Economic and Employment Services. We do thank you, committee, for the opportunity to testify. This is a large bill and we don't have a lot of time. So we are really trying to stick to just a few technical or fiscal comments. We feel like the able-bodied adults without dependents has been covered very well. The other opponents gave some very good information, particularly on the exemptions. And then just saying that this bill would remove any discussion of any groups that you may want to have a few more months of food. Just because wildfires, are in the news this week, it just makes me think about that. Counties could ask for just a few more months of food assistance for the ABODs in those counties, things like that. Again, I think everybody has that information to make that decision, and this bill would just remove any discussion regarding that. The work programs, we could share a lot of information on that. I think I'll save those comments to see if anybody has any other questions on it. DCF does have, for the first time ever in the history of SRS and DCF, a statewide program available This did roll out in 2019. Hasn't had too much of a chance of seeing what it can do with the pandemic. But as stated, it is voluntary. We're not really sure what the effect would be of a mandatory program with the ABODs, because as stated, during non-pandemic times, they would exit the program anyway after 3 months, if not working or in a program. And it may actually increase participation because individuals who did not find their way to a program or let us know they're in a program may be enrolled, and then that would extend their work. We do take the work programs very seriously, and the fact that the USDA has said if you have a work program, it has to be real. You need to be helping people. We do feel like the amount that we spend per person, $33.45 a month, is very conservative, and it just shows what a good job our staff do on connecting with other programs that are already available out in the community. Just a couple of technical comments. A brief touch on the portion about law enforcement assisting with electronic benefit cards. We want to note that everyone is very clear that the food assistance retailer operations are under the jurisdiction of the federal government. States have no authority to complete any compliance checks on retailers. The enrollment, the compliance, all that is the federal government. States, however, can provide information and coordinate concerns that they find when they are investigating any client concerns. That's usually with the USDA Office of Inspector General. So supporting that coordination with the OIG and with the SLEBs, the state law enforcement bureaus, is fine. It has been suggested from our federal partners that if individuals were assisting in any coordinated investigation with OIG, they should be certified law enforcement officers. And we are exploring what that might mean when we see KSA 5602G, which in their definition states that DCF staff are not to be law enforcement orders. So not sure what all that means. Also mentioned there's been a few paragraphs regarding the data matching agreements. There is an attachment to the testimony which lists 14 data matches that currently exist. Also mentioned previously, any changes in that would require IT costs to both a sending and a receiving agency. That was not included in the fiscal budget. And one in particular stands out to me. It asks the Department of Labor to provide semi-monthly potential changes. We currently and have probably since the beginning of all these programs, the data match with Department of Labor, but their information is collected quarterly. Not speaking for that agency, but it does seem like this would require a change from every single business in Kansas, because that's who reports the information into them. They do that quarterly. It's on their public website, if anybody would like to see that. DCF also has a work verification service, which is a service that employers subscribe to. And that's where we can verify for any employers that are enrolled with that, current wages and status of hires. One other item that's not really been given much time here that is really huge, it's the biggest part of this fiscal note, and that is the request to change the process and timing of how changes are reported by food assistance households. Now, these terms are USDA terms. They allow us what methods are approved. Kansas currently uses a simplified reporting method. That does not mean people are put on assistance and no changes are made for 6 months. Individuals are still required to report when they occur if they're over income, if they're not meeting these ABOD requirements we've been hearing about, if they have substantial lottery winnings. The agency also acts on any changes that it's known to the agency. For example, a state calls up and says, Sandra is applying for food assistance in my state, then we obviously would close our case and let them know. Because we do have this simplified reporting, we also do a 6-month check-in where a report, an interim report, is sent to the participants. And we do all of the electronic checking again and set the program up for another 6 months. With the monthly reporting, that is not part of it. So the case would go for a year without being checked on. And then it would be up to the participants to report any changes within 10 days. The reason the USDA went to simplified reporting way back in 2003 is because it reduced the reporting and the frequent recalculation of benefits, both are which very prime activities for errors. There's some examples in the testimony about like example of a small change. So one month I get $50 in assistance, the next month my changes go back, I go 70, the next month I have another change, I go 60. Instead of with let's simplified reporting, you could get 60, 60, 60. I am calling out that's a little bit of a oversimplification, but I think it'll help you get the idea. So in closing, go ahead. No.
I was just going to say, could you please wrap up? If for the sake of time, I'd appreciate it. Thank you.
Yeah, thank you. Thanks for the time. As you can see in the testimony, there's only one state out of 52 states and territories that utilize this monthly reporting, that is Maine. And that just seems to indicate the challenges with the constant fluctuation to us. Thank you very much. And I will be nearby for any questions. Thank you.
Thank you. Next, we have Tara Mays, Vice President of State Legislative Relations for KHA. Welcome, Tara.
Thank you, Madam Chair. Thank you for members of the committee for allowing us at KHA to provide some comments on Senate Bill 501. I think as you all have heard here this morning, we at KHA have about 15 member hospitals that qualify for presumptive eligibility. And I just wanted to highlight to you all that these hospitals are required, as Director Fertig mentioned, to meet some very specific thresholds to even be eligible to participate in presumptive eligibility. As she mentioned, those determinations do ensure that we have 95% of PE determinations that are completed accurately, and 98% of all of those PE determinations and care applications have to be submitted to that clearinghouse, as the director mentioned, within just a couple of business days. And so our hospitals already do have a place in process to notify KDHE of all of the presumptive eligibility candidates that we do see coming through, but I think you would be surprised that's a relatively small number in the grand scheme of things. However, as we read this bill and the contents of this bill, we have heard a couple of questions from our members that I just wanted to express to you all today. First, we wanted to raise that it seems just a little bit unclear to us on page 2 of the bill. It talks about if hospitals fail to meet certain standards that are proposed here. It talks about all applicable staff would need to go through mandatory training. Our hospitals have questioned us with what is applicable staff. We would assume that means all of the those that are qualified to do presumptive eligibility, but that seems to be just a little bit unclear to us, and we wouldn't want to be unnecessarily mandating training for staff that don't necessarily do presumptive eligibility. So I wanted to raise that to your attention. We have also heard from some of our hospitals that this is one of the functions that they may look to outsource, so that we would ask this committee to ensure that the bill creates opportunities for us to continue contractual agreements for the processes set out in this bill and handles those contractors similarly to those that would be in-house hospital employees. So we would ask that if the committee works Senate Bill 501, they consider those suggestions. I'd be happy, Madam Chair, to stand for questions to appropriate time.
Thank you, Tara. Committee, next we have Lindsay Ford from ks.gov, and I believe she's virtual.
Yes, hi. Good morning, and thank you all so much for your time today. I think most of my fellow conferees have done an amazing job of articulating some of the issues with this bill. I just want to take a moment and draw some attention to survivors of domestic and sexual violence. My organization, the Kansas Coalition Against Sexual and Domestic Violence, represents survivors across the entire state. We have 25 member programs that serve survivors in every community. And this bill would create a lot of burdens for those who have like a legitimate need for assistance. Again, I think many of my conferees did a great job of articulating some of this, but I just want to point out that this bill ignores some of the basic realities for those who are living in poverty, some of the stresses that are associated with that. Specifically, when we talk about young mothers and children who are frequently people who avail themselves of our services, they're often in the midst of crisis when they come to us, and they are dealing with some really traumatic events that have caused a good deal of stress. And even after the immediacy of those stresses and those dangers have subsided, they will have ongoing concerns about their safety and ongoing trauma that makes it difficult to focus on some of the burdens that this would put into place. And if I could ask for your indulgence for just a moment to kind of think about some of the most stressful times of your life and how challenging it can be to focus on specific details and requirements that might come about during those periods. The changes in the reporting requirements on this bill would ask survivors to really respond to changes in their life in such a short period of time that it would create a lot of burdens in an already very stressful period. As some of my fellow conferees have said, this bill, these changes, they're not going to help people escape poverty. They're simply going to remove the possibility of state benefits helping them do so. And for that reason, we would ask that you seriously consider that the effects of this bill are going to outweigh any perceived benefits of passing it when it comes to helping survivors across the state. And with that, I would be happy to stand for questions.
Thank you, Lindsay. Committee, we're going to circle back and see if Megan Word was able to join us. No, okay. So I believe those are all of our in-person opponents. Committee, I will draw your attention. I believe if I counted right, there are about 30 written-only opponents to the bill. So if you would please take a time, I'm not going to read those names, but I want to draw your attention to that. And at this time, we will open up for questions for opponents.
Madam Chair, I have a couple of questions. This is Senator Petty.
Yes, Senator Petty.
So my first question is for Karen Siebert, I think it is. Karen?
Yes, hi.
Hi, Karen. Thanks for being here. In your testimony, you had mentioned that SNAP is funded 100% by the federal government. Is that correct?
The benefits, yes. We share administrative costs between the state and the federal government, and I believe it's a 50-50 match.
Okay, so the benefits that come to anyone that's on SNAP are 100% federal.
Correct.
And I noticed in your testimony, and I think, I appreciate this, the time frame we have here, but you mentioned about the impact positively that SNAP has for our local economy, for our grocers. Could you expand on that?
Yes, SNAP brings in about $300 million in SNAP benefits into the state every year. And those, I think it's one of the best economic generators we have because fully 97% of those benefits are spent by SNAP recipients in the month that they're received, and they're spending those directly in local grocery stores to feed their families. So it's very important, especially for, I think, for our rural communities, our rural grocery stores, to have those SNAP resources in their communities.
And just lastly, you didn't speak to this, but I noticed it was mentioned in the bill about some sort of investigation or using the fact that someone might use their SNAP benefits out of state.
Yes, that's actually entirely legal to use your SNAP benefits out of state. It's a federal program. We had a similar situation. We had Senator Blunt visit Harvesters. We also serve on the Missouri side. And there had been a situation in St. Louis where someone had used their Missouri SNAP benefits in Hawaii, and people were all up in arms at how awful this was. What was actually awful is that this family was an active military family that made so little money that they were eligible for SNAP, and the military family had gotten transferred to Hawaii, and they were utilizing their SNAP benefits in Hawaii. And as I think Sandra from DCF mentioned, there is cross-check between the states. So if someone does move, the states are required to check that. And if it's the case, as in the case of that Missouri situation, the Missouri DSS would have seen that and stop the next month's payments. You know, there's always that point at which you move, and you can still use the benefits that are on your card. They would stop those payments, and then that person would be transferred to Hawaii and do that in that state. So I think that, and then also, obviously, in Kansas City, we're in the metro area. I live closer to many Missouri grocery stores than I do some Kansas ones, and so it's perfectly fine to do that.
Thank you. Thank you, Madam Chair.
And while you're up, I just have a follow-up question based on Senator Petty, so that you don't have to jump up and down and play musical conferee chairs today. As it relates to the $300 million going to local grocers, I don't think anyone doesn't want families to get what they need and families, anyone to go hungry. So, but I would just like to ask, where does the federal government get that $300 million?
Those are federal tax dollars that we're paying into the program. But what I'm saying is when we're specifically talking about what do Kansas taxpayers receive in return if people are not getting those benefits, those don't come back to the state. They stay at the federal government, at the federal level.
And is it fair to say that taxpayers in Kansas are paying for these benefits in other states?
Correct.
So it's a federal, so the point being that these are dollars that, they're taxpayer dollars that, barring this, would have been potentially in the local economy. So this isn't like money that isn't coming from taxpayers back to the community, correct?
Right. I'm saying that we do pay those taxes in. What I'm saying is that we get double taxed because now we also have to go and support all the charitable food pantries because our money has gone to the federal government to support these programs. If we turn that money away, it doesn't come back to us. And in fact, we have to help fund those local food pantries.
Understand, and the point being that this is not necessarily a $300 million economic incentive, since it is taxpayer dollars. That would be my point.
It's not an incentive, but it is a benefit, yes.
Okay, thank you very much. Other questions?
Yeah, Senator Erickson, this is Senator Kristen O'Shea. I have a question.
Yes, Senator O'Shea, who is your question for?
Well, so my question is just for any of the opponents. I heard a lot about children and parents, and it was my understanding that this piece of legislation affects single people. So can someone explain why we're hearing about children and families and things like that?
Certainly. And if you would just state your name again.
Karen Siebert from Harvesters, and I'll take this one. I think particularly the SNAP Employment and Training Program issue is specifically for able-bodied adults without dependents. But the other things like the reporting where you have to report changes within 10 days, that affects every single SNAP recipient. That affects the disabled, parents, senior citizens, everyone. So that's the way, and I think that's where a lot of people are going to get tripped up because 10 days is not a long time, and some of these things are requiring written proof, and sometimes you don't even have that within 10 days of a household change that might occur. So I think that's, and it says in the fiscal note, because it would increase the error rate, we would have some significant costs from the USDA for fines because we aren't able to track all of the requirements in that short time. Does that answer your question?
Senator O'Shea,
Yes.
do you have a follow-up?
That's all for now.
Committee, I would appreciate some flexibility and indulgence here. I'm sure if Senator Hildebrand were here, this would not happen, but we do have two other conferees that have made themselves available. I want to go ahead and let them testify, and so that we can ask them questions during this time if need be. So we do have Sean Gatewood with us, so Sean, I apologize for missing you earlier, but he's with Can Care Advocates Network. Welcome to the committee.
Thank you, Madam Chair. No need to apologize to me. I've had a rather rare morning that got me here a little bit late. So thank you for allowing me to testify. And I think this goes a little bit to Senator O'Shea's question, and I want to make my testimony very short today. My concerns are largely sort of mechanical in the the workings of the Can Care program and how this would function. We are going to be facing the unwinding of the public health emergency, and that is going to put tremendous stress on the current Medicaid eligibility process as it stands. And I think that many of you will recall just a couple of years ago, we had a backlog in the Medicaid program in the eligibility side that was, weeks, sometimes months long. With the unwinding of that program and just getting things sort of squared away, adding additional pressures into that it gives us a tremendous amount of pause. That gives us, I can't even describe, because what we're talking about was, frail elderly seniors, trying to get them into nursing homes. They were in crisis and we were delaying them. I don't want to get back to that. I don't want to get back to pregnant women having to delay care. And this bill doesn't get exactly to that. What the problem is additional stress inside the eligibility program. They're already short-staffed. They were already at the max. We just got it squared away. They're going to be stressed already as it is. This puts additional pressure on it. With that, we oppose the bill and appreciate your indulgence.
Thank you, Sean. And committee, we do have Megan Okay, I understand she's going to try to join us. She may have some difficulty. When she does, committee, I'd appreciate us pausing on questions in order to allow her to testify. So we will continue with questions for opponents. Senator Thompson.
Thank you. I'm not sure who would be appropriate to answer this, but one of the things I hear is the reporting timeline is too short. Is there a timeline that would be acceptable that would still help this bill go forward, but allow for a little bit alleviation of some of that stress? That maybe Sean could even speak to that.
And Humphreys, if you could just please restate your name for the record, it would be much appreciated. Thank you.
I'm not sure I entirely understand the question. Can you kind of?
Well, you talked about putting the stress because the reporting timeline is so short, 10 days. If we expanded that reporting timeline so that there's a little more time for reaction and handling those things, I mean, is that your primary objection? Is it's got people running in circles, or is there more? Is there an appropriate amount of time that you would consider?
So I'm not entirely, of course, I'm not in love with that timeline, but my objection is largely putting any additional requirements at this time, given we know what we're facing with the unwinding of the public health emergency, where we're going to have, thousands of folks that are having to be reevaluated. I don't want to put any more pressure on the eligibility system at all.
All right, thank you. Thank you, Madam Chair.
Other questions?
Chair, this is Senator Petty. I have a couple of questions.
Yes, Senator Petty.
This is for Sandra from DCF.
Are you still with us online?
Yes.
Okay, very well. Proceed.
Hi, Sandra. Thank you for being here. You had mentioned in your testimony that about the information is collected quarterly. Trying to look at my notes here. That presently you collect that information is collected quarterly by the Kansas Department of Labor. and that in the bill, it has a different timeline. Is that correct?
Yes. Department of Labor is actually in there 2 times, but one of the times it mentions semi-monthly, which is a complete change from what is now. And we just wanted to call that out. And we have had, our systems have a talk, and as I said, they have probably since the beginning of the programs. And DCF has access at any time. A worker can anytime go look and see what the last quarter wages and employment has been reported.
And so having that kind of requirement in the bill, that, well, it has a substantial, I'm understanding this, it has a substantial cost, but it also is not the way that, since the Department of Labor collects their information quarterly, this would then, would it make it impossible to get that information?
Well, yes, I think that's probably a good word. I mean, if it was passed and all the agencies were doing this to the letter of the law, it seems like every business is going to have to change how they report, that they now report quarterly. They get their business records, they send them in, you know, and because it says semi-monthly. So I'm not an expert on that, not speaking for them, but we just felt that was, that needed to be pointed out. That needed to be clarified in some way. Mm-hmm.
Thank you. I appreciate that piece of information. And then I had a question for Sarah from KDHE, for Sarah Fergus.
Sarah, are you still on WebEx with us?
Madam Chair, sorry. Sarah has had to step out. She had a conflicting appointment, but
Okay.
I will be glad to try to answer any questions on her behalf.
If that's acceptable, Senator Petty, please proceed.
Thank you. Sarah had mentioned about data sharing, and that you already do data. There already is data exchange, and so I was trying to. I think she mentioned that this that it would have an SGF cost of $500,000. Could you just expand on why that cost would be created?
Yes, so the data sharing that we currently have may not gather the information that we need to comply with some of the new requirements. So we have data sharing with the Department of Labor, for example, but we do not have data sharing with, we may not be gathering the right data elements. So even our interfaces between systems would have to be modified. We would have the protocol and we would know what to use, but we would have to have additional data elements in order to monitor the new things that we need to monitor. And the creation of the new interfaces and between all systems, we would need to also then take that information, and our system will need to recognize that information and say, okay, so now what do we do with that information? So it's just not gathering the information, but also creating the task or the next step for that information to be processed throughout all of the systems, including our payment system.
Thank you, Christine. Thank you, Madam Chair.
Committee, we do have Megan Word with us, I do believe, so
Yes.
we'll go ahead and accept her testimony. So Megan, thank you for finally being able to join us, and you may proceed.
I apologize, and I thank you all, committee members, for your indulgence this morning. I misunderstood. I thought I was supposed to be written only, so thank you. I won't take up a lot of your time. I'm the Government Relations Director for the American Cancer Society Cancer Action Network, and most of the opponents have articulated our concerns. I will just briefly point out that the new section about the presumptive eligibility and eliminating that would certainly curtail eligible women from being able to access the Early Detection Works breast and cervical cancer screening programs. It would put one more barrier and add time to how long it would take them to get those screenings. And so for that point in particular, we oppose this bill. There are other sections that I outline in my letter, but in general, the American Cancer Society Cancer Action Network believes that access to timely, affordable, comprehensive health care coverage is critical in the fight against cancer. And in our opinion, SB 501 creates barriers to that access rather than eliminates them. And so we oppose.
Thank you, Megan, and thank you for hanging in there with us.
Thank you for hanging in. I appreciate it.
Absolutely. Committee, our committee is dwindling. As time goes on, I'm kind of taking it personally here in the Capitol, but for those still online and those people who are sticking out for the marathon of this hearing, I appreciate it. Are there any other questions for opponents? I'm not even sure we have any other committee members, but okay, I'm going to take that as no additional questions. Thank you, conferees, for being here. We will close the hearing on Senate Bill 501. In order for us to proceed with the rest of the agenda items, which is approving minutes, I'm not sure we have a quorum at this point, so I am going to get with Chairman Hildebrand, let him know we did not take action on those today, and we will do that next week. And so with that, everyone stay safe out there, and we are adjourned.